I'm Karen from Action Kidney Cancer. Today's topic for our Ask the Expert video is rehabilitation after kidney cancer surgery. Today I am joined with consultant urology surgeon Steve Leung and renal cancer nurse specialist Lisa Dunbar. Both of them work in the Western General Hospital in Edinburgh. Our first question today is, what is the first step post-surgery? If you could please share your answers with me, that would be great.
Yep, no problem, Karen. I think the most important thing in the initial post-op period and the advice that we give patients is mainly 3-step goals for them. The first step that we ask our patients to do is to get out of bed as soon as they can and as soon as they're able to mobilise short distances around the bed area and around the ward area. This is really important first goal in the initial post-op period, as it reduces the risk of DVTs and encourages good posture to aid our second request. And our second request for patients is to make sure that they're doing deep breathing exercises. And these are a regular cycle every hour of taking big deep breaths in order to prevent chest infections in the initial post-op period. The third thing is, and this kind of ties in with the first 2 requests, is we ask patients to engage with regular analgesia and painkillers, encouraging patients to request pain relief and if their regular medications are not adequate to control their pain. This benefits both mobility and deep breathing exercises and really aids recovery. We do this by making sure that patients are counselled very well in the pre-op period. We give them out a booklet that talks about being fit for surgery, that explains how best to get out of bed, how best to do their deep breathing exercises, and indeed just talks about some forms of painkillers that they can get while they're in the ward. So we're as a team, we're hoping that supports the ward nursing wider team to encourage patients to mobilise and just get out of bed and be more as active as they can in the initial period.
And I think from a surgical point of view, surgeons always obviously make a bespoke decision on what type of surgery the patient can get. We can offer patients robotic surgery, laparoscopic surgery, which is kind of termed minimally invasive surgery. And I think a lot of people are aware of this. This usually involves sort of small incisions, keyhole surgery as such. And this offers the benefits of smaller incisions, reduced pain, and quicker recovery. Some patients may be offered open surgery, and that involves a big incision for the patient. And this obviously is much more, I suppose, morbid for the patient because they've got a large wound to recover from. I think what is good for most people is that they get to see the anaesthetist beforehand, and the anaesthetist can then discuss some of the techniques that the anaesthetist might use to reduce pain after the operation, such as using local anaesthetic wound catheters, spinal anaesthetic, and epidural anaesthesia. And it's all about making sure that patient after the operation, their pain control is as good as it can be, and this then promotes a quicker recovery in the initial few days after surgery.
Can I just ask, regardless of the type of surgery the patient gets, because you've spoken there about 3 different types, would you hope to give each of that type of patient the same form of post-surgery treatment as you discussed, Lisa? Would that be the aim?
Yeah, I mean, regardless of the surgery, the advice would still remain the same, that 3-pronged approach of early mobilisation, deep breathing exercise, adequate pain control in the initial period after their surgery prior to going home. It would stay the same.
Thank you. The next question that we've had from patients is, what can I expect in the initial weeks after surgery? So they've had their pain and everything managed, and they're now being discharged possibly, and all being well. So what's the next step for these patients?
I think we advise a realistic approach to recovery, and we certainly tell patients that they should be planning for a 6-week period of recovery. Patients need to be prepared and counselled that they will have some limitations to their lifestyle for this time scale. But usually those significant restrictions are really in the first couple of weeks after they get home. We like to set expectations for recovery based on pre-op levels of fitness and activity. I think that's important to understand what the patient's baseline is prior to the surgery, and aim for that in a 6-week period. We advise lots of rest while still encouraging regular leg exercises and movement around the home. But particularly in the first week or two, it should be lots and lots of rest with a slow build-up of stamina and exercise tolerance thereafter. We explain that any exertion, be it going for a 20-minute walk or a shower or going out for a coffee to meet somebody, really should be followed with a time of rest. And patients should plan those rests into their daily activities, particularly in the first week or two directly after the operation. We advise no strenuous exercises, things like weights or heavy lifting is a no-go for 6 weeks after this operation. We don't encourage any return to any gym work or anything like that in the first sort of 6 weeks. But we do encourage daily walking, initially a 20-minute walk daily with a slow build-up as the weeks go on. With regards, patients are always asking about returning to work, and our advice to them is, if it's an office-based job with little in the way of manual work, patients are likely to be ready to return to work sort of a 2 to 4 week period after this operation. But again, a gradual return with lots of rest planned into that return to work. Consider a phased return to work if you have a supportive employer. With regards a manual role and things that involve heavy labour, we are really advising that a 6 to 8 week period off work is necessary, and again a phased return would be recommended in that period afterwards.
I think you make a very good point, Lisa, about some patients who perhaps aren't as fit before surgery and worried about the effects of surgery on their recovery, on their back to baseline. A lot of institutions up and down the country are looking at sort of rehabilitation. So I think that is something that anaesthetic departments are very focused on. And that's really to have a kind of deep dive, a kind of deep understanding of what the patient's sort of preoperative functional abilities are, how well they can climb steps, are they breathless at all, and then perhaps instigate some sort of prehabilitation sort of exercise to build them up for surgery. So I think that's a very topical thing for patients to be as fit as they can for surgery. And I think we're also, as a team, very focused on, what the patient may experience after the operation. So perhaps if you have an open operation, then that's a bigger wound to recover from. So we'll obviously give, bespoke advice to the patient to perhaps leave more strenuous exercises or manual work, to be undertaken a bit later on in the recovery.
Thank you, Lisa. So our patients are they've had their recovery, they're doing well. My next question is around, when would they contact you to seek further advice after surgery? At what point should they be picking up the phone and having a conversation?
I think we're very fortunate in Edinburgh in that we have a good CNS support network for these patients. We counsel before they go home about their clips, if there's clips in situ, if they need to be removed, surgical clips, and we counsel them when, to go to the district nurses or the practice nurses for that. We're very clear on the advice we give patients about wounds, dressings, keeping an eye out for making sure their bowels are moving, making sure they have no urinary symptoms, making sure they have no temperatures when they go home, making sure they have no unexpected pain that they hadn't necessarily experienced in the initial post-op period. We counsel them on how to reduce down their painkillers over a period of time in the post-op recovery period at home. And then the last thing that we do is important is we safety net, and we make sure that the patients know that they can call the CNS team, myself, in with hours, and I can give advice and have patients admitted if required, but also to make sure that they are aware to seek out of hours help, or certainly going to the GP to get help if they require it. What we certainly counsel patients on is seeking prompt help if they think that they're just not right. Peace of mind is priceless, and it's often better to get these things checked out if they're unsure of anything at all.
Yeah, absolutely echo your advice, Lisa. And I think the important thing is, some units do have very good nurse specialist support, and sometimes patients can be a little bit confused as to who to phone first when they've got maybe perhaps different, different contact numbers that they can contact. I think the main thing is that if the patient feels unwell, and most patients know what their body's telling them, and if they feel that they're just not right, and then the first protocol really is your GP, and if out of hours, then it's the appropriate services.
Thank you. So after your 6-week period and you're starting to get life is looking much more like the life you had prior to surgery, what happens then? You've had your cancer diagnosis, you're now back at work. So what is monitoring going forward? What is the future looking like? What can they expect? What can a patient expect there?
Yeah, I think, certainly in most institutions, the surgeon sees the patient back at about 4 to 6 week period. And that's really to, like you say, go over the diagnosis and really find out how the patient's recovered in that time away from hospital. And hopefully they'll be back to what they were doing, and they'll be, hopefully in a place to really speak to the surgeon and understand what their diagnosis is. At that time, we give them the histology, the results from the removal of their cancer. And in our institution, we base a lot of our follow-up on the results, on the histology, the pathology of the cancer itself. And usually, for a lot of the types of kidney cancer, we can group this into the kind of low, intermediate, and high risk group, and our follow-up is sort of dictated on which category that patient falls into. And we're very fortunate here to have Lisa doing and leading our kind of follow-up for our patients, but usually it's a kind of 5 to 10 year period of regular surveillance scans.
Yeah, I think this is a really critical time for patients in their cancer journey, because I think at this time they tend to come off their roller coaster, for want of a better word. They've been on a journey that maybe has lasted 6 to 12 weeks, where they have had CT scans, they may well have had biopsy results, surgery, focus then on their recovery. And then the 6 week mark can often feel like the patients are being maybe cast off into the ether a little bit, because surgery is finished and complete. And I think it's very important to stress that at that time, the continued support continues within the urology team. And we try to counsel patients to say, well, actually, just because surgery is over you do not require any more treatment, it does not mean that you have been discharged from the urology department. We stress that they are under our care for, as Mr. Leung says, for 5 to 10 years, depending on their risk category of their histology. And that's where I come in to make sure that particularly the intermediate and the high-risk patients are seen face-to-face in clinics on a regular basis, maybe 6 months to yearly, to make sure that they are accessing that support that is available to them in the long term. Then there is a combination of face-to-face clinics and telephone clinics, but that patient has always got that support in the long term. And I think it's important that they understand that from our department.
Yes, and I think it's important that patients understand that as a form of treatment, that the scans are a form of treatment. And we know from our closed group forum how important that peer support is when they're waiting for scan results, because that's an anxious time for them. And it's good for patients to know that they don't need to be alone in that period. They've got marvellous support from their hospital and their caregivers, but they can also look to charities like Catching Kidney Cancer to step in and offer that patient-to-patient support if it's required.
Yeah.
I think you raise a really good point, Karen, is that despite a lot of our patients not requiring any treatment, which is great, people can be anxious when their yearly scans or twice yearly scans come around because of fears of recurrence or fears of the cancer coming back. And I think having that safety net of health professionals as well as support that your charity can offer can highlight these issues to the healthcare professionals and address these anxieties and worries as well. So that's, I think, is very important. That it's not just the surgery, it's not just the treatment, but it's what happens afterwards.
Yeah, and I think it's great when you can see everyone working together to help deliver good outcomes for people after surgery. So all that's left to say is thank you very much, Steve, and thank you very much, Lisa, for answering our questions today. Thank you.